All right. Good morning, and thank you for joining us. My name is Brother Kevin Ford Jr., and I have the privilege of hosting an exciting webinar for you all today. Today's topic is actually going to be on medical cannabis. We're going to be discussing modern day pain management treatment. Here in Maryland, medical cannabis has been around, or well, it was established legally in 2013, but officially launched and opened its first dispensary in 2017. Since then, our patient population has grown to over 160,000, and we just wanted to make sure we provide you all with some information about cannabis, its therapeutic and adverse uses, and as well as any other things that are about medical cannabis from the patient and consumption perspective. I have two great guests joining me today for this topic. I have Dr. Obi Anyewu, who is a double board certified pain medicine physician who practices at the CHOICE Pain and Rehabilitation Center in Maryland, where he serves as the medical director. He earned his medical degree from Temple University School of Medicine in Pennsylvania and completed his residency in physical medicine and rehabilitation at Georgetown University Hospital. He followed that with an interventional pain medicine fellowship at the Mid-Atlantic Pain Institute. And he is dedicated to eliminating acute and chronic pain disorders with minimally invasive techniques and helping his patients with complex pain concerns and help them return to their regular activities. Dr. Anyewu also served as the outgoing chair for the Maryland Medical Cannabis Commission. So we are delighted to have him join us today. Secondly, we also have Dr. Rasean Hodge, who is my Morehouse brother. Shout out to Morehouse. He also graduated with his medical degree from Robert Wood Johnson Medical School, which is at the University of Medicine and Dentistry in New Jersey. And he completed his family practice residency in Southwest Hospital in Atlanta, Georgia, where he is now the medical director for First Choice Pain Care. Dr. Hodge also recently graduated from the University of Maryland School of Pharmacy, Masters of Cannabis Science and Therapeutics. So he brings a different perspective, a classically trained perspective on cannabis to this conversation. So we're delighted to have him today as well. Welcome to you both. I just wanted to give you guys just a quick opportunity to give a quick 30-second spill on medical cannabis and what that has meant for you all in your practice, as we've seen medical cannabis start to grow and be available in more states across the country. Dr. Obi or Dr. Hodge, whichever one wants to go first. Oh, Dr. Obi, you're still on mute.
Thank you, Kevin. I'll go first, if that's okay. So I'm a pain medicine physician. I practice with interventional pain methods, but my interest spans homeopathic options for managing pain, including other things that are like acupuncture, physical therapy. People practice yoga, and of course, medical cannabis. As Kevin mentioned, I was the last or the outgoing chair of the Maryland Medical Cannabis Commission, and I was appointed, but to that position in 2019. But my interest in joining the commission was primarily to make sure that we had cannabis represented for underprivileged population. At least from the standpoint of just clinical treatment, I see a lot of patients who are on opioids, and one option is to help with their pain and anxiety issues by, transitioning to some form of cannabis, especially elderly patients who aren't really candidates for surgery or, pain interventions, and who can't really tolerate opioids or can tolerate, very low dosages of opioids, and cannabis can be a helpful option for treatment. I see the role expanding in the state of Maryland and certainly across the U.S. And there's a complex relationship with the U.S. government and cannabis, as you all are aware, especially the federal government. Most of cannabis is legalized by states. It's not on the federal statute. It's still not legalized. It's still a Schedule One drug, but we're hoping that that changes in the near future. Dr. Hodge, you're up.
Hey, Kevin, thanks for the intro. Doc, great to see you again. I'm honored to be on this panel. Quick 30 seconds. Not just as a physician, I'm also a patient. I broke my neck, had a basketball injury in 2012 where I fractured my C-spine, ended up getting fused and ended up with chronic pain. We all know cannabis can help with chronic pain, but we're all in a quest to kind of discover our best version of ourselves. So cannabis, along with helping me with my chronic pain, has also helped me with my quest of discovering the best version of me. So as a physician, as a father, as a community leader, it's my duty to share this information, help people fill in these knowledge gaps. And if cannabis, if the benefits outweigh the outcome, here's a prescription, here's a recommendation. Maybe you want to get into this career. So it's important that we have this conversation. Again, I'm honored.
Appreciate you. So one thing I wanted to kind of touch on first before we get into it, we know that in the Black community, there remains such a large stigma surrounding cannabis and just negative perceptions. We've seen that perception start to shift. Even here in Maryland, we voted for legalization of cannabis at 72%, which is the second highest among ballot states in the country. And with that, I guess, in terms of how you're approaching this topic with patients in your office, what do you say to them to ease some of their worries about this stigma that exists due to, decades and generations of generational trauma that we've experienced from the criminalization of cannabis?
Well, I'm glad you brought that up. I think certainly that, the stigma of cannabis use has sort of shifted, through the decades of use. And you're right, it used to be highly criminalized in the minority population. And now, a lot of states are legalizing it. I'm not sort of naive to the point that I think the government or government officials are accepting it in states because they believe in its medicinal uses. I think a lot of that has to do with, tax income or revenue for the state itself. And that, despite public opinion, I think that, at least from the standpoint of the legislators, that's what pushes it from my perspective. In terms of, patient population, I think it's important to explain to patients who are, naive about the medical benefits of cannabis, that it's not the same thing as people getting weed off the street. It's sort of well tested. There's a lot of research out on it now, whether the reviews are mixed, or not, but there's a lot of good research out there that shows what the benefits are. I think it's important to share with patients, getting it from an appropriate dispensary where it's regulated in the state, goes a long way, especially when considering the fact that, the individuals who use cannabis still off the street, can have contaminants in it. At least from my perspective, that becomes important. The other important issue is to share with the patients, that they don't have to use it as an inhalant. A lot of patients who don't smoke, don't want to smoke cannabis, and it's important to share with them that they can have it in a multitude of ways that they can get it into their systems, where they have edibles, they have gummies, they have tablets, they have rubs, they have droplets in concentrates. So there are a lot of ways to get into the system too. The other thing I tell patients in the state of Maryland, one of the things that we did was mandate that dispensaries have individuals, who take the courses and learn about the pharmacokinetics of cannabis use, the side effects, and the appropriate, medical effects for different conditions. In our state, we use it. It's legalized for anorexia, for cachexia, for pain, for spasms, um, for anxiety, for PTSD. So having individuals in dispensaries be knowledgeable about it. And take courses. That was a big issue, to take courses like the one Dr. Hodge took. And they don't have to take the entire course in terms of getting a full master's degree, but they have to be educated. And I think we selected a certain number of courses for the managers or the individuals who are the medical directors of those dispensaries to use, so they can advise patients appropriately on the use of cannabis for different conditions. So that's how I approach it when I'm discussing it with patients. Also, ensure that once they get it, that they start low, they start slowly, they experience in small quantities first, before expanding on it. It may not work for everyone. There are over 100 different species of cannabis plants that are processed for different reasons and different ways. And it may take a while, just like any other pharmaceutical, for a patient to find the right match for what their condition is.
Thank you for that. I heard you speak about a few things when you were talking just now. You talked about safe tested products. You talked about the difference between that and cannabis that you would buy off of the street. You talked about product types and methods of consumption a little bit. We're going to come back to that. But one thing I wanted to make sure that we dive into before we move forward is the entourage effect and what that means and how that affects you. And I'll let Dr. Hodge talk about this a little more. Each of us has this system called the endocannabinoid system. And these products have different compounds within it called cannabinoids. And then there are also terpenes as well, which create this entourage effect. But I'll have Dr. Hodge touch on that a little bit more.
Well, thanks. The entourage effect is something that's recently have been discovered, like within the decade, when we're still learning about terpenes, the other aspect of cannabis, flavonoids. We're still learning how that affects this entourage system. So cannabis is a great balance regulator of our systems. And the endocannabinoid system might just be as important, not vital, as the cardiovascular system or as your respiratory system. But it helps regulate all those systems. And the systems is a group of organs. With the endocannabinoid system being activated in this entourage effect, we're learning that you get the relaxation of cannabis through your CB1, the psychoactivity with your CB1, right? Receptor that's mostly located in your brain and your CNS. I'm trying to keep this layman so everyone understands. But when you take a Motrin, everyone is taking the ibuprofen. That ibuprofen targets a receptor that's going to help with inflammation, that swollen ankle, that painful knee, right? Now, we just learned through the entourage effect, and I'm smiling because I'm like, I kind of figured this out because I'm also a patient. And I'll explain why I'm smiling. So cannabis will not just activate the endocannabinoid system. And Kevin said endo because it's endogenous, it's naturally in us, right? And when I talk about the endocannabinoid system, I always want you to look at your thumb, a fingerprint. Everyone has their own unique endocannabinoid system. So all that bias that we're all going to get the same effect from a Percocet, which we know is impossible. Okay, now we're starting on the level. Okay, I understand you. At least we're admitting, hey, with cannabis, that hey, everyone's going to have a unique experience to it because of that. No one has their identical endocannabinoid system. So going back to this entourage effect, it's not just going to activate your endogenous receptors for cannabis. It's also going to say, hey, PPAR receptor, that same receptor that you took that ibuprofen, you took that Motrin or Aleve for, it's going to also activate that. So now we know, hey, cannabis is going to give you these effects that we all know about cannabis, but it's also going to help with inflammation. It also is going to say, hey, you have these serotonin receptors. The same, if I write you a prescription, you can't see it. If I write you a prescription for Zoloft, an antidepressant, I'm hoping prescription is going to interact with your serotonin receptors. With the entourage effect, we now know, hey, it's not just going to hit your PPAR receptors for anti-inflammatory, for immune boosting, for digestion, for relaxation. It's also going to hit your serotonin receptors, which is going to help with emotion, help with mood. It's also going to help with TRPV receptors, which also helps with reducing pain, reducing inflammation. So that is what we know about the entourage effect. Every day, I think we'll get closer to really figuring out the dynamics, the fundamentals once we can do more research with descheduling. Once it's not a class 1 drug, we'll have all these answers, Kevin.
So let me ask you this, and I guess just in terms of breaking it down in layman's terms, right?
Yeah.
Everybody, okay, when you think cannabis, okay, this smoking this plant is about to get me high, right?
Yeah.
So let's break down like what that high means, and then we talked about endocannabinoid, but we talked about endo, but we didn't talk about cannabinoid, right? And there are two cannabinoids which are the most prevalent, right? We have THC and then we have CBD, right? And
Yes.
Dr. Hodge, if you could just break down quickly the difference between THC and CBD so our viewers have a little bit of understanding between the two.
Okay, THC and CBD, those are the first two discovered cannabinoids, components of cannabis. And again, to all the viewers, the textbook of cannabis is this thin. So I don't want you to think I'm way ahead of you. You can digest this stuff and have the same knowledge and make the same decisions for yourself, for your family, for everybody. So don't be overwhelmed. This is fairly new. When I'm saying fairly new, CBD was discovered in the 80s. THC was discovered shortly after that. So THC, this component of cannabis, is responsible for the high, the psychoactivity that's attributed to ingesting or inhalation of cannabis. Be careful. You might go to a dispensary and you pick up a topical rub and it might have THC on it and CBD. Be careful of labeling. Again, it's important that when you get a cannabis card or you're referred to use cannabis, you understand, because that's post-tax dollars. THC rubbed on your skin can't penetrate deep enough to get you high. So do you need THC creams? No, just stick with CBD. Um, Now, CBD, again, cannabidiol for short, is another component of cannabis. It is very popular. There's an FDA-approved drug that you can pick up from a pharmacy called Epidiolex. Um, the reason why this drug is FDA approved because CBD causes no psychoactivity. It has less than 0.3 of THC in it. So 4 years ago, this pharmaceutical company could use cannabis, got the CBD out of it, package it into pills that Doc and I prescribe to kids with severe epilepsy and another pediatric seizure disorder called Lennox-Gastaut syndrome. So that's just the beginning. There's other FDA THC drugs,
CBD,
AIDS, wasting, and that's THC because the THC doesn't just cause you a high. THC can stimulate appetite. So again, that's one reason why you'll use THC.
Excellent. So you mentioned you got into pediatric use. Before we go there, we're definitely going to come back there. I wanted to go back to the different types of products that can be used, as well as the different methods of consumption. Dr. Obi, you mentioned earlier, well, and I'll say in a lot of my conversations talking about cannabis, most folks only think that, it's just this plant that you're rolling up and you're smoking,
Sure.
However, there are many other methods of consumption, as Dr. Hodge mentioned, inhalation and topicals with the creams on the skin, um,
Edibles.
edibles, sublinguals, transdermals. So can you provide some insight onto some of the different product types that we have here in Maryland, as well as the different types of consumption that you recommend for your patient based on maybe a couple of different ailments that folks might be going through?
Yeah, it's interesting because the quickest way to get any cannabis product into your system is by inhalation. And to some extent, the probably greatest bioavailability as well. But that doesn't work for everybody, and not everyone needs that, and not everyone wants that. And there are also some, other effects, of inhalation that, I think patients probably need to, be aware of in terms of some of the negative effects as well. So, I think that you discuss with patients depending on what their needs are, whether it's, someone who has cancer patient who's going through anorexia, who can't eat because of the chemotherapy, you want that effect from it. And they can get that effect, from almost any form of cannabis that they use. In general, my recommendation often, are sublinguals, which are easy to absorb to and easy to use. It can come in the droplet, especially given the fact that if someone doesn't have an appetite, offering them an edible may not be the best way of getting the medication into them. Um, sometimes it depends on the patient too. And what they're going through, I may recommend an inhalant. Um, and just like Dr. Hodge mentioned, there are topicals, that have a great concentration of CBD in it, and versus the THC, which is not needed for the topical portion of it for the patients as well. Often in my elderly patients, I recommend a combination of both. If you live long enough, you're going to have a lot of degenerative, joint disease, and this is what most of my elderly patients, complain about. So I use a dual action. It could be, and most of them don't want an inhalant. So I usually, recommend a topical and combined with, either a pill or a sublingual, version of it. Um, I like that too because I think a lot of times I find, a lot of my elderly patients, especially the ones who are octogenarians, they don't eat that well. It helps stimulate their appetites. It helps their mood as well, which is great, and certainly it helps their pain. For other patients, I think that, I see a lot of patients in chronic pain who have mood disorders as well. Yeah, we're going to touch on this probably later, and Dr. Hodge knows this, and the medical psychiatric community, they're not big fans of using, cannabis for these conditions. But in the state, it's one of the indications, whether it's anxiety, it's mood, whether it's post-traumatic stress disorder too. So, I think most of my patients who have chronic pain have mood disorders. It's almost a continuum. And I think using cannabis, with the combination of, its pain relieving factors, as well as the mood improvement is always a benefit. And that's what I want to touch on, how, cannabinoids interact with opioids. And there are a lot of different studies that discuss it. And it's really more of an individual science in terms of understanding, how each different opioid reacts with cannabis in different forms. In some, scenarios, you can have some opioids, and this is where the provider needs to be educated about it. Can interact with opioids where it can potentiate the way an opioid works. And by that I mean, you can have greater bioavailability of the opioid at lower dosages, which is a positive. In some scenarios, depending on the opioid, it may be inhibitory. So it may block, the process of how the opioid is metabolized in our systems, and therefore, having less of it, available for its active, use. So I think those are important things to understand about, how the two interact in terms of, pain management.
Appreciate that. So the other day, Dr. Hodge, you mentioned, a lot of us are in this in-between stage where, we're taking care of kids and taking care of parents. Can we start to go into some of the pediatric care and therapeutic uses for pediatric patients for cannabis?
We're in a day and age, I don't know what it is, hormones, food, devices, but autism prevalence is off the charts. 1 in 50 deliveries, that child will be diagnosed with autism or some type of autism spectrum disorder. ADHD, attention deficit disorder, again, the prevalence is alarming, 1 in some 40. And then if you look at adults, 1 in 7 adults might have ADHD. It doesn't go away. We're learning, hey, this pediatric disease we thought was just some kid stuff never goes away. So those are just 3 diseases right there where parents, at least here in Georgia, are saying, hey, we don't want to do the Adderall. We don't want stimulants. We don't want a drug that is one double bond away from meth, you know? We got friends talking about being in that sandwich group with kids, you're going to have peers, as I'm 48, that haven't stopped taking Adderall since college. They got one in their wallet. So a lot of these drugs for attention most definitely lead to abuse. So cannabis can help with attention, help with autism. We just talked about how it can help with epilepsy and seizures. These are all pediatric issues, diseases that can be very debilitating. And first and foremost, we have to talk about sickle cell. We know the prevalence of sickle cell anemia in our community. We know the life expectancy. They have an arduous process. It's hard for them to gain respect in these ERs. Most of these doctors and healthcare professionals think these 10-year-olds, these 11-year-olds, these 7-year-olds are seeking opioids, seeking drugs. People still don't believe that they're in pain. I proudly sit on the board of sickle cell here in Georgia, and I implore all my sickle cell babies and my sickle cell caregivers, hey, you might want to consider cannabis. Again, because we just talked about, Dr. Obi just said, hey, man, if you're in chronic pain, you're most likely going to have some depression and some post-traumatic stress disorder, some body dysmorphic syndrome. You're going to have anxiety. And these are all invisible scars and invisible illnesses. They wish they could show you how bad they feel because they just look normal. So, again, another overdoses. We talk about opioids. Overdoses is killing our teenagers more. It surpassed car accidents. Again, I'm 49. Car accidents was the #1 killer. You made it past 24. Driving, you could probably live to 100. Now it's suicide again, and it's not violent. It's medication. Everyone on this live, cannabis has caused 0 deaths. So with safekeeping of cannabis, whether it be an edible, whether it be a topical, whether it be the flower or your vape pens, the poison control is going to stop. All those numbers are going to start decreasing in every state. The only reason when you research and you see cannabis, wow, because there's so many more users. Therefore, there's going to be more calls to poison control because of not safekeeping, poor education. You want to protect your babies. You want to protect your son. You might not know what they're going through, but they're not going to overdose on cannabis.
And that's one thing that I think is interesting. And then even legislatively, Maryland, I feel like, has done a great job really making sure that they focus on adolescent use. And for all those folks who are watching out there who think that, oh man, you're about to have a 10-year-old smoking a joint, that's not what it is. Actually, pediatric patients are not allowed to buy inhalation products here in Maryland. And well, pediatric patients aren't allowed to purchase anything. Pediatric patients will have to have what's called a caregiver attached to their account, which is their parent, guardian, or another adult who is a caregiver for them, who can actually go into the store and buy these products on their behalf. This past legislative session earlier this year, there was a bill that also passed that allows students to be administered their cannabis by their school nurse in school. We had one gentleman who was having seizures all the time, and he couldn't get his medicine at school because it was illegal for him to do so. So there was a major push for Marylanders to allow school nurses to administer cannabis on site. So that was a great win for the pediatric community who needs medical cannabis. Since we've talked about adolescent use, child use, let's shift it over to seniors. In Maryland today, one of the largest populations of cannabis patients in Maryland is actually our senior population. I know that we talked about different consumption uses, and a lot of folks who may even be at a senior living facility, they might have certain rules about consumption that, doesn't allow them to smoke cannabis on site. So they have to use some of those other types of products, such as edibles, tinctures, the transdermals, and things of that nature. So Dr. Obi, if you can kind of give us some insight on seniors, and I guess what you're seeing from your senior patients who are using cannabis right now.
Yeah, I mean, it's a great product for seniors. Like I said, there are a lot of other medications that we use for pain, primarily for pain for seniors, where their systems can't tolerate it. They have side effect profiles that are contraindicate their use for anti-inflammatories, for instance, which like ibuprofen, which can cause gastrointestinal problems like gastritis or stomach ulcers. It can cause cardiovascular effects as well, and or opioids, which can cause issues of over sedation or dizziness or create fall risk for these patients. And cannabis in an appropriate setting is an ideal medication for these seniors. And again, there are some, like you said, there may be some facility regulations that may prohibit it, and that's where the other options for how it can get into your system becomes important. But I do have seniors who prefer the inhalant, and one of the reasons is because of its quick acting process. Other ones, like I said before, you can ingest it, you can use the transdermals, you can use topicals, which are absorbed into the subcutaneous tissue for their effect. So I'm a big fan of the use of cannabis in seniors. I do want to go back and touch on something that Dr. Hodge mentioned about sickle cell patients, which is a high population in the African American community, and undertreated, and pain in general. There's a lot of research in terms of the undertreatment of pain in general in the African American community and the minority community at large. And I think the bias is interesting because even in hospital ERs, they know what sickle cell is, but there's still a bias in terms of how they administer pain control to sickle cell patients who are admitted to hospitals, and how we administer pain control to sickle cell patients who are out of the hospital. Because they've been discharged from the hospital doesn't mean that their pain issues are over. There are a lot of complications from sickle cell disease. One that sticks out is something called avascular necrosis, where the blood supply to joints and bones in the joints is cut off, and the portions of the bone die. So because they're not having an active sickling crisis doesn't mean that they don't have progressive chronic pain related issue. And again, I have sickle cell patients who I have on a combination of different medications in the outpatient setting, and cannabis is one of them as well. So I think that's important to note, as you know, in this sort of broader discussion.
And for my elderly folks, I love taking care of the elderly, because they're my parents. My parents are still living, and I got a mom diagnosed. She's got end-stage heart failure. She's got diabetes, insulin dependent, and recently dementia. So these are all conditions, that not just my mom, that's your mom, that's somebody's dad, that's somebody's uncle. Plus, we're trying to take care of these kids, like we're talked about. And we watched our parents never get better. You know, it's just more medication, less hope, more medication, hope getting diminished. And these golden years aren't so golden the last 10 years. Uh, Talking about diabetes, most diabetic patients are on nerve pain pills, gabapentin, Neurontin, because that blood sugar starts to deposit into your nerves, and now they got their feet
Neuropathy.
hurt, neuropathy. Cannabis can get them off that medication. Uh, it can help improve blood pressure. It can help with some of that anxiety, some of that sundowners of dementia. I've seen it. I've seen it time and time again, and I've seen it personally. Um, and then I also do hospice and the life care, palliative care. Uh, when the healthcare system, God knows everything, right? But when the healthcare system thinks you have less than 6 months to live, they're gonna say, "Hey, man, we did all we can do. The specialists, you, it is what it is. This program called hospice. Your loved one is dying. Doctors are gonna give you this e-kit, and it might be some viewers that have been through this e-kit that have lost a mom or dad and seen it. It's got morphine, it's got phenobarbital, there's some Tylenol in there, suppository, which you can give a cannabis suppository. So we don't need the Tylenol. We don't need the morphine because you don't have to be wide awake. You can be in a coma. I can rub some cannabis oil under your gum. You don't have to be awake enough to control your airway. Your veins and the arteries on your tongue is going to absorb that medicine. We can use the rectum. So we can still use all these things at the end of life, even to your last breath. Cannabis can replace all those pharmaceuticals. The last push of big pharma, you can still use the plant. Um, for my elderly, they love vapes. Again, inhalation is the most common way to consume medicinal cannabis because it's the fastest, quickest onset. If you in pain, you can't wait 30, 45 minutes for digestion. A lot of elderly people have gastrointestinal issues. They've been had years of ulcers, years of reflux disease and heartburn. You think they're absorbing stuff like you and I are absorbing stuff? So that vape pen, which again looks, it consists of a battery, has the cartridge, which has the medicine in it, and it has an atomizer to turn it on, right? Three little parts, right? It doesn't create smoke. All smoke is an irritant to the lungs. But the great thing about the vape pen is they don't have to grind the dry flower. When I broke my neck, I couldn't use a grinder. I had terrible neuropathy. Elderly people, they have arthritis. They can't use that grinder. And pre-rolls are just too expensive. This vape pen, you just hit a button. So because of their reduced hand dexterity, vapes are amazing. All my elderly, like, you know what? You can wrap this thing around your neck with a lanyard. They can't lose it. And they can titrate to effect. You pull on, hit that button, and you inhale. And when you feel a little better, you just let it hang down. You're good. So uh, the stigma is definitely, like you said, baby boomers are the fastest growing consumers of cannabis. Um, Most of my peers are saying, "Hey, doc, man, I see mom and dad ain't doing well. They've done years of this big pharma, boom, boom, surgeries. What about cannabis?"
So you just mentioned one thing that I think we have a question from our viewers about this specifically, which is about vaping, right? We know that over the last couple of years, there have been reports in the news that have said that vaping could be harmful to you. One thing that was found in these vapes that were literally killing people was they were mixing it with vitamin E acetate, which is a thickening solution to essentially help the producer cut and stretch their cannabis oil that they have. And I know in Maryland, I know Dr. Obi can speak to this, in most regulated environments, you wouldn't find that type of material within your vape cartridge. So Dr. Obi, can you talk about that a little bit?
Yeah, that's true. In Maryland, like as you mentioned, there's a harmful effect, and back when the commission was part of a government agency, I mean, it was actually banned because they did research and they saw the harmful effects of it. So um, I think that's a good thing. And again, for the producers of these things, it's a way of, like you said, it's an economic decision in terms of how they process the medications for consumption. I think that there, without question, safer ways of producing these products, and vaping is a good safe way, as Dr. Hodge said. Versus like you said, grinding the flower down and rolling it and smoking it, where any inhalant, as you mentioned, can be dangerous to your pulmonary system. And even though uh, individuals or patients who use cannabis, they probably smoke less than people who use nicotine products that we know are harmful. But one of the differences is when they inhale, they hold it in. They hold the smoke product in of the inhaler when they use it in wraps, brown flour, and sometimes that can be a problem in terms of our pulmonary systems and other things that can be complications. But I think the vapes, without, like you said, those harmful products, is an absolutely good and safe alternative,
Appreciate you.
and best for elderly patients. I think that like the other thing I do want to mention, you brought up the elderly, is also being careful in terms of some aspects of cannabis that can affect balance, can affect memory and things of that nature. I mean, in having this discussion, most of my elderly patients come in with their children, and it's a sort of a delicate process of introducing that to the conversation, not knowing what their background is or what their beliefs are, or what their biases are, so but I think my job, and I think most healthcare professionals who are proponents of cannabis use or medical cannabis use, I tell my patients my job is to give you all the options, not some of them. And part of the medical options that I find beneficial and would include medical cannabis, and that discussion will include potential side effects, and to make sure that they're aware of it, and how to sort of like work towards the appropriate optimized use of it, and minimizing the side effect profiles that can be harmful.
Right. So one thing I wanted to even add on to the vape conversation, just from a community and consumer perspective, a lot of the conversation legislatively is that, oh, well, we don't want cannabis in our community because I don't want to smell that stuff everywhere I go, right?
Yeah.
And the vape pen is another option as well that won't give you that cannabis smell and have it lingering all over you, that so many of us unfortunately just don't like that smell, so there are other options to ensure that you don't have that smell tagging along with you.
Great point.
That's true too. I just want to add something that, again, when you're going through a legal dispensary process, certainly in the state of Maryland, some of these things are, the aroma is engineered out. You can engineer any aroma into a cannabis product that gets rid of what we normally sort of smell from marijuana off the street. But certainly those vape cartridges, you don't smell any of that.
Yeah.
So we've talked a lot about the positive sides of cannabis, and we briefly mentioned a couple adverse effects, but I want to get back to the adverse effects, and even goes in with our next question. Someone asked, are there any risks to becoming addicted to cannabis? And have, what you all thought? I will start with Dr. Hodge.
Yeah, too much of anything becomes a poison. The number one abused drug in the world is caffeine. And how do you feel if you miss that morning cup or 3 cups of coffee? Withdrawals. We all experienced it. So with cannabis being a drug, there's a potential for abuse, and we call it abuse potential. The withdrawals, if you do develop cannabis use disorder, it's just like alcohol use disorder. It's just like opioid use disorder. Uh, we don't call it addiction anymore. We call it use disorder. But there's a difference. We talked about cannabis causing no deaths. Um, Alcohol withdrawal can kill you. Doc knows if someone comes in, if an alcoholic comes in to the hospital, we have to put them in the ICU because that person not having a drink could send their heart into arrhythmia and they can die. There's another common prescribed drug where the withdrawal can kill you that a lot of people take. That's Xanax. That's Ambien to help sleep. That's alprazolam. That's Valium. All those drugs are called benzodiazepines. You have to be in the ICU, again, if you miss some of those prescriptions because they can kill you. So again, with a drug being a drug, too much of anything becomes a poison. Cannabis use disorder can develop. It's the same questions that as a physician that I'll ask someone that drinks. Do you have an eye opener in the morning? Do you ever feel bad or get angry if someone says, hey man, you should slow down on your cannabis use? Do you mismanage bills and get in trouble or late to work because of cannabis? Have you ever tried to stop? The same questions, the same 4 questions we ask for alcoholism, for opioid disorder, healthcare professionals do the same for cannabis use disorder. So that's one thing that can happen. And that's a natural thing because if you're using cannabis as medication, you're going to develop tolerance just like the caffeine. Just like that 1 cup of coffee don't hold you all day. You need 3 cups. You're going to need to increase your dose because of tolerance. And if you're using cannabis, because I have cannabis use disorder because I use it as medication, it's inevitable. I rather have cannabis use disorder than opioid use disorder. Going through constant withdrawal, sweating, bowels all messed up because of the opioid use disorder. So again, if the benefits outweigh the negative stuff, choose that medication. At least if you can't get a hold of it, it ain't gonna kill you.
Let me also ask this real quick. Let me just sneak this in. Over the past couple of years, there's been a rise in cases of cannabinoid hyperemesis syndrome, right? Or CHS. Dr. Obi, can you talk about that and what that is and how that's affecting people?
Yeah, it's like after you may use medical cannabis or cannabis in general for a number of years and you will be fine, get all the good benefits from it. And then one day you wake up and all of a sudden it's causing you to be nauseous all the time. Use of it creates nausea and vomiting, and that's where that emesis disorder, that's what it means. It's that, that vomiting aspect of it that come along. And the recommendation then will be to stop it, to come off of it and to stop it. Now, I have patients who develop it. It's like anything else. And then sometime down the road, we can reintroduce it again, slowly and see how they respond to it. But that's real. I do want to touch on some of the other things that Dr. Hodge, had mentioned about, cannabis use disorder very similar to opioid use disorder or, alcohol use disorder, and how, in medicine, there's been a shift in looking at these disorders as, medical issues, which are sort of the complexity of your genetics as well as your environment, and looking at it more, these things more as medical issues so they can be treated without the stigma, versus, something that like an addiction. I also push back in general about some of this is, the difference between the disorder and the dependency. In medicine, we have dependencies for a number of things. Diabetics are dependent on insulin, as an example. People who have, depression, which can be, often is a chemical disorder, become dependent on antidepressants. People who have high blood pressure, again, there may be no other factor associated that you can identify, and there's something called benign essential hypertension, become dependent on antihypertensives. And if you stop any of these medications abruptly, you're going to have a harmful effect from it. So whether you talk about withdrawal in opioids, withdrawal in cannabis, if you stop insulin in diabetic, their blood sugars will rise and they'll be in the hospital soon. The same thing with people with hypertension. You stop their medications, they can have strokes and heart attacks. So I think, from the medical standpoint, I think about the use of all of these medications in terms of their dependency and need. Your system needs it because it serves a purpose, a good purpose, when you use it in their system, and stopping it abruptly. And we often tell them about this with any other medication. Don't stop it abruptly. A lot of times we have to back off of it. The same thing with cannabis. Absolutely, cannabis can be, I'll use the word addictive, just as Dr. Hodge said, anything that's used in excess, can certainly cause a problem. And so, having responsible use in any medication, and that's where the next step is. We call it medical cannabis because, cannabis is actually, sort of the technical name for the plant, that marijuana comes from. And getting away from marijuana and weed and things of that nature in our lexicon becomes important. So, I think understanding it and thinking about it as a medication for use for different disorders or different medical conditions is where we're heading now. And I think that needs to be important. The other things in terms of the medical conditions for cannabis that, we have to be careful about, when there are issues for kids. And I know Dr. Hodge can speak on this too, who are using it without regulation, especially when they use, street versions of cannabis all the time. There are a lot of issues with memory that comes along with it that also affects their capacity to learn appropriately, that we have to be aware of. And we have to regulate and inform the public of that as well, so that they know about it. In our elderly patients, the issues to do it balance, because we don't want them to be fall risk. They have to be aware of that. There's some negative cardiovascular effects when it's used in excess, that we have to be aware of, or if the patient has, a precondition, that's cardiovascular nature, that we have to be aware of and share with the patients as well.
So as we start to wind it down here, we have about 5 minutes remaining. We have 3 other questions here in the chat from our viewers. One is there any evidence that heavy illicit use leads to other mental health problems, such as paranoia or cognitive decline?
None.
None. Short answer. Appreciate that.
No bias. No bias. And it's not because I use and consume.
Well, I would agree.
None.
Yeah, I will say this. I don't think there's every patient is an individual. So we're not, no one's monolithic in terms of how your body or your body physiology processes any medication or the effect of it. There, sort of cardiovascular drugs that work for some patients that don't work for other patients. Right. They're good drugs where patients have side effects to that other people don't have side effects to. And there are times in which we see patients who are using, cannabis, who are admitted with, issues of paranoia. That's true. So I think, but there's no related scientific evidence that there's that correlation as a whole effect for that class.
Right. And they might be talking about how cannabis, there's this big lie out here, that stigma that cannabis can maybe cause schizophrenia. No, it cannot. Yes. Even if cannabis use in adolescence, those kids that were studied that developed schizophrenia at 15, 16 were going to develop it anyway. So cannabis maybe, it's not a fact, can bring those symptoms and of schizophrenia out maybe 2 years out earlier in your adolescence. So instead of 21, you're full-blown schizophrenic, you might be full-blown at 19. But as far as anything with the brain, we know it helps PTSD. Your cerebellum, your amygdala, and your hippocampus, 3 major parts of your brain is helping. There's other neurodegenerative diseases that we're studying cannabis for. Alzheimer's, not just Alzheimer's dementia, other types of dementia, cardiovascular dementia. So the brain, we're going to be targeting some type of cannabinoid, flavonoid, terpene is going to do a lot of mood developing drugs. That's all in the pipeline, all will be prescribed, will all be taken one day soon.
Even for things like multiple sclerosis as well.
Thank you.
A lot of people don't know this. Everyone thinks about, weight gain with cannabis use, but there are aspects, and what I think about the multiple species of the cannabis, plant that are processed, there are different ways to manipulate it and it's going to be coming down the pipeline too, because obesity is a big issue in the United States, where there, parts of the chemical that can also help with obesity. And we're going to be seeing that, down the road as well.
And you really almost hit that on the head, because that's what I was about to say in terms of paranoia. And honestly, there are certain strains that will have your brain racing. There are certain strains that will turn your brain off, And I think it's just important to know, what is in this particular strain that you are consuming. Right. So like for me, there are two, we talked about THC, CBD. There are also 2 main terpenes, and Maryland is one of those states that gives you a full terpene profile, so you can kind of understand that, right? So you have limonene, which is going to be more of a sativa or a head high type of psychoactive effect, whereas then you have myrcene, which is more of an indica or in layman's terms, an in the couch type of effect. Right. And those 2 things, for me, I have migraines. And when I consume products that have a high level of limonene, it gives me migraines. Right. It can bring on an on, but I know that, and I think that it's important for when you're going to these dispensaries to really talk to the medical director, talk to the dispensary agents to try to pick the appropriate product for you. But we do have to close it down, unfortunately.
Great point, Kev.
We already knew that we were going to need a part 2, 3, and 4 on this topic. So hopefully we can continue the conversation going into 2024. And we did have one question, so I'm going to address this. It says, how would you convince a hardcore cannabis smoker that is used to getting illegal products off the street to actually use medical cannabis in the store? It's safe, it's tested, it doesn't have the type of pesticides or heavy metals or molds. The thing is, it's just like some people, you wouldn't trust somebody cooking you food out of their kitchen, but you'll go to the restaurant, right? It's the same thing. You never know what's going to be in that product. And that's why when you have these thorough testing that's done by these independent testing labs, we know what's in these products. We know that they're pesticide free, or at least to a safe level that would not give you any short-term or long-term concern.
Yeah, there are appropriate pesticides that are used for growing the plants too that don't harm the body system.
Exactly. And I gotta throw this out there too, just as a Black man, Black people, it might be legal here in Maryland, but some police departments may not be all the way up to speed, and one thing that I love to tell people about medical card is that within the cannabis legalization bill that was passed earlier this year, medical cannabis patients have legal protections for actually having cannabis on you. Okay. So I think that is a major, I think, influencer in terms of getting traditional street weed smokers, as I would say, to come over to the medical cannabis side.
And last point too, Kev, too. Can I get a point too?
Yep. Absolutely. Both of y'all get a closer
if
point.
you're on papers or if you're a felon, it'll be discriminatory for you not to get a card. So you can still get a medicinal cannabis card if you got PTSD and you've been banged up, locked up on papers. When you do your urine drug test, you just show them your card so they can't ding you for cannabis on that 5-panel urine, hail, 7-panel, and that's going to alleviate a lot of your stress. Also, a lot of patients, well, it's a federal illegal drug. I got my gun license. I got to have, it's my constitutional right to have my gun. You can have both. No one's going to say, give me your registration for your gun card because you have a cannabis card. That's all hogwash. You can have both. Lastly, what worked for me and what's helping my patients and caregivers is that if you do decide that cannabis is for you and you understand that, hey, this is something natural, it's going to beget other successful behavior. It's going to help, hey, if I maybe eat right, they've been saying to eat right forever, I start eating right. Sleep. Most people that are using cannabis are saying, hey, let me explore this with exercise. I don't care who you are, heart disease is still the #1 killer. Heart disease, cannabis can help be a motivator to help you exercise regularly, not just weekend warrior stuff, 6 days a week. It's great for recovery from exercise. And then you understanding, hey man, I seen my parents' life and their health just deteriorate from being on 11, 12, 15, 16 pills. Give your kidneys a break. Your kidneys got to get rid of all of that stuff. Everything we put in our body, our kidneys got to get rid of. Why is kidney failure so high? Why are there dialysis centers on every corner? Think. It's some of that is the medication. Cannabis doesn't harm the kidneys. Peace and be well.
So I'm gonna add this because I'm glad you talked about the gun legislation too, which in Maryland you cannot have. Which, although I know that with the legalization of it, and even prior to the legalization of it, it doesn't make any sense. But I think the legislators are moving towards getting rid of that rule, which is a good thing. It doesn't make sense when alcohol is legal and you can have a gun permit or own a gun and drink yourself to oblivion and have car accidents, liver failure, issues to do with spousal abuse or abuse in general with alcohol. But
#1 date rape drug is what, Doc?
Yeah. What's that? Say that again. Yes, gateway drug is alcohol.
We all got kids. We're trying to protect the kids. What's the #1 date rape drug? Alcohol. Always has been.
Alcohol.
Cannabis,
100%.
no. All that trauma that people can't talk about from alcohol. We got to have a series 5, 6, 7, 8, Kev.
So I think it's why we're going in that
we got
direction.
to turn this up, bro. We got to have more of these. Thank you.
The other thing I want to touch on briefly outside of the gun legislation is understanding that even though you have a card, you have a responsibility to use it appropriately. You're not going to get away with driving in the state and being intoxicated by using medical cannabis in the wrong way and not be charged. You will be charged if under the law of driving while under the influence, or along those lines too. So everyone who has a card, you have to be responsible. From a medical perspective, my patients who have drug toxicology testing, I always recommend it. Get it legally, get it with a card, because just as Kevin Ford mentioned, there you can have a contaminant in it that shows up in the urine toxicology test. There are also a lot of other aspects of safety that the state regulates, because they're liable too if they don't. That other producers on the street will not, but again, when used appropriately, it's a safe and obviously good option, for a multitude of treatments. It affects a lot of organ systems in a positive way too. And the last thing I'd like to say is get educated. There are a lot of these myths that are out there about, medical cannabis and cannabis in general that are not true, even among physicians who are not advocates of it. I think physicians need to be more educated. The public needs to be more educated. Certainly, our legislators need to be more educated, so that they can get it off, take it off as a Schedule 1 drug on the federal level too.
Well, docs, we definitely appreciate you both for joining us. If you made it to the end of this webinar, you probably think, well, maybe I should just go get my cannabis card. So just wanted to run these back down for you again in terms of the specific illnesses that qualify in Maryland. You got chronic pain, which is the #1 most referred ailment that folks have. You got severe nausea, seizures, muscle spasms, wasting syndrome, glaucoma, PTSD, anorexia, severe or persistent muscle spasms, and my favorite one of all is any other debilitating medical condition that your doctor says that you can have medical cannabis for. So essentially, it's anything. If you say
It's
you don't want to
everything.
take this
Pretty
anymore,
much. Yes.
then you can ask for cannabis, and your medical professional or certifying provider should be able to give that to you. If you have any questions, please feel free to reach out. There are a bunch of different resources available about Maryland in general. And if you find me on Instagram or anywhere at K4 Jr. and follow us on Instagram at Gamma Pi Chapter, we'll be happy to answer any questions that you have. Appreciate you all for joining us today, and we'll talk to you soon.
Peace and power, bro.
Peace, docs. Y'all have a good one.
You too. Thank you.
Bye-bye.